So I'll start with a little bit of history because throughout the history of surgery, we've dealt with hiatal hernias, and it began as really an anatomic repair, meaning they really weren't sure what it was. There was a hole in the diaphragm, and so they fixed it. And Allison published on that, but then they recognized the relationship to reflux, and they began to repair the hiatal hernia alone, and found that maybe 50% of the patients continue to have reflux, so they knew that that wasn't the entire answer. Ron Belzy is the one who's really responsible for identifying the relationship, and he kind of, through a series of operations, was able to show that about 50% of the reflux control has to do with the hiatal repair, and about 50% has to do with the fundoplication. And so although Dr. Nissen is certainly famous for his work, Dr. Belzy is the one who did all the research behind that. The other thing that we noted is kind of in the history of reflux surgery that hiatal hernia had a very significant part in the failure after surgery. In other words, people would get a hiatal repair and a Nissen fundoplication, and when they failed, a lot of the ideas surrounding why they failed had to do with displacement of the wrap and movement of the wrap through a hiatal hernia and just a hiatal hernia. And so about January, I think it was 2010, we had a conference in Dallas, and we were reviewing some of the slides that I've shown you and talking about the hiatal hernia problem. And it was suggested actually by Reg Bell that we may need to start doing hiatal hernia repairs. So I took that to heart, and I went home, and well, I was in Dallas, so that was home. And I started doing hiatal hernia repairs in patients in which I could clearly demonstrate that kind of laxity. And I had done about 24 patients. I probably had done about 20 at that time, and we did a few more TIF onlys. And then we started looking at anybody that had a Hill 3 junction and recommending hiatal repair laparoscopically and then transoral fundoplication. And I explained to the patients that these are really two separate procedures. We can do hiatal hernia repairs for any other number of reasons, bands or sleeves or bypass or whatever situation. The fundoplication really is a separate procedure. And that's the way I explained to the patients.